Now what I want to talk about, Ian, are some things that a tennis player can do to make sure that they're maintaining their elbow, wrist, and forearm appropriately.
Okay.
They do have some performance enhancement implications, but a lot of these more so are maintenance exercises and rehab type stuff that you would do just to keep the flare-ups to a minimum, especially when it comes to lateral epicondylitis or even medial epicondylitis. If you're having problem in the tendons and the muscles on the inner and outer aspect of your elbow from a lot of playing.
So tennis elbow.
Tennis elbow, exactly.
Okay, all right.
The first thing I want to review are some common stretches that get all of the muscles of the forearm appropriately.
Okay.
All right, very simple to do, great thing to do. What I would recommend is you do them before you play, but warm up first. After your body is warm, then do the stretches, then play, and then follow your playing with the stretches after the exercise as well.
Can we talk about tennis elbow just briefly?
Definitely.
Generally, that's just typically tendonitis, is that right? Just
Yes,
kind
a lot of times
overuse,
it's either a tendonitis or a strain of the muscles that attach to the outside or the inside of the elbow. And it can be due to overuse, it can be due to something being too weak and not being able to handle the stress of playing.
Okay.
It could be due to improper grip. It could be due to the grip on the racket being too thick or too thin. There's a lot of different components. It could be due to the shoulder and to the core. There's a lot of outside components that play a part in it too. But it's an inflammation of that tissue that attaches to the bone there that just kind of continues to be a pest, and not necessarily may stop you from playing, but will hinder your performance and lead to breakdown.
I've seen it stop players before.
It definitely can when it gets to the point where it's significant in pain and, and inflammation.
In my experience, I've found that a lot of times players who struggle with it have a really hard time finding a way to target it to actually get it better. Is this a specific injury that, in your experience, is kind of hard to treat as well, or not really?
The key to treating tennis elbow is finding the root cause.
Okay.
And Vlad talked about it in his discussion about how it could be anything from the neck down to the fingers. It could be muscular, nerve, or tendon. It could be joint. There's a lot of different causes that can lead to someone developing tennis elbow. The key is that you're having someone who knows how to perform that thorough assessment, take a look at it when the symptoms have lingered longer than they should, more than a week or two, and have gotten progressively worse with swelling and consistent point tenderness.
Okay.
At that point, you want to make sure that you are being evaluated so you know what the root cause is, again, so that you're treating it and keeping it from being a recurrent problem, rather than just putting a Band-Aid of treatment on it.
Right. All right, let's take a look at some exercises.
Okay, some of the stretches. The first stretch we're going to do, we're just going to target the wrist extensors, flexors, and the supinators of the wrist. So first thing is just palm forward, okay? All right, up, down, and turn around are the three stretches. First one is up. Going to be pulling on the top of the fingers to get that stretch along the bottom side of the forearm. Okay. All right. With these stretches, you want to hold them for 10 to 15 seconds, multiple reps, 2 to 3 times ideally, to get a really good stretch. This is also something you can do if you go up against the wall to get a good stretch as well with this. Pulling the fingertips back so you get the tendons through the hand as well as the forearm muscles with this stretch.
If somebody at home is struggling with tennis elbow down at the bottom there, and performing a stretch like this kind of makes it angry, if it's painful, is this something that they should be doing?
This is a stretch where you don't want to do past the point of pain. If you do have some discomfort, you want to just stretch to the point where you feel tension, not so much pain.
Okay.
And very slow, progressive hold into that stretch, holding it for the length of time. If it does inflame it and make it more painful, even with backing off and doing it lighter, then again, you don't want to do that. You probably want to follow up with a medical professional to find out what's going on. This is stretching the primary muscles that help to grip the racket. So this is a very important stretch. Okay, on the flip side of that, you're going to go down. Okay, so same arm position, but now you're pulling your hand down. Okay, first with his palm open, so he's going to really get a good stretch through his forearm here in the back of the hand. But then also you can also curl your fingers underneath with the same kind of stretch. That's going to place more tension on the tendon on the back of the hand, so you get the muscular stretch with the hand open, and then when you pull the fingers in, you get more of that tension across the back side of the hand too, so you're getting the entire length of the the tendon and muscle stretched.
Are these good for wrist mobility as well?
Definitely, and
Okay.
it's going to improve your flexibility and your mobility of your wrist with both extension and flexion. And if you're doing your stretches and the mobility is not improving, it may be a joint issue, in which case you would want to follow up with a physical therapist or athletic trainer or a medical professional who could address that issue for you if the stretches are not enough.
Okay.
And then the last one is up like this again, and then you turn it around so that you're getting your rotational muscles of your forearm stretched. Okay? So pulling the fingers back in this supinated position is going to stretch the muscles that assist with turning your wrist over when you're striking the ball. And you can even, as you're doing this, rotate your arm even more to get even more of a stretch into that rotational component with those muscles. And same thing, 10 to 15 second holds, 2 to 3 times. Should be feeling a muscular stretch. If you're feeling a pinch in the joint, you shouldn't be jamming into it. It's a more gentle stretch, and if that doesn't resolve with just range of motion, then again, looking into a professional to help you with that.
Okay.
So those are 3 stretches that are really important to do both before and, but more importantly, after a lot of playing, to keep the muscles at their normal resting length. Once they're fatigued, they will tighten up and they'll shorten, and you want to make sure that you're keeping them at their regular length so it's not leading to spasm and inflammation.
Okay.